So for this session, basically, yeah, sorry. So this is a brief history of health and medicine. So your learning outcomes are basically, I hope you can see my screens and hear me proper. So in this unit, you should be able to understand the concept of healthcare in the 18th and the 19th century. Okay, so this is what your learning outcome number one is for this first lesson that we will cover shortly. And in this, there's some topics that you should be able to understand and work on them when you have your assignments. So we'll discuss the assignment next weekend on the Saturday. So here you would want to be able to summarize the patient knows best approach to medical treatment in the 18th and 19th century. So there's some reading material that we have uploaded on Moodle, so you can have a look at them, and they're there for your understanding. Where did the slide go? Sorry. Yeah. And you would want to explain in detail how dissection, so dissection was cutting up of humans, it led to the practices now used in modern medicine. You should be able to evaluate the importance of the rise in laboratory medicine in hospitals, and you should clarify what is meant by the germ theory. So these are 4 points that you need to know. You need to understand. We'll go through them one by one. And the second learning outcome is to understand the changes in medicine that brought about today's concept of doctors know best approach. So the first is the patient knows best, and the doctors know best approach is the second approach that we'll talk about. That is for your second learning outcome, which will be covered tomorrow. So here you're summarizing the way in which key individuals contribute to modern medicine. Okay, and for example, there's Lister, there's Pasteur, we'll talk about them. Hello to everyone who's joined. We'll just go through introductions in a bit. And then we'll explain in detail how the invention of key medical implements and machines advanced medicine. So how have they played a role in medical advancements? Sorry. And in the third bit, we would want to analyze how the advances discussed in this criteria and this criteria, how have they affected and changed the domain from to the patient. And so basically it was it is now everything that we're doing is patient centered. Initially it was the physician or the doctor centered approach, which has now changed. The concepts have changed. So this is a bit about what the brief history of health and medicine would be about. Coming towards introductions, good morning. I'm Dr. Anita Khoso, and I'm your facilitator or your tutor for this session, today's session and tomorrow's session. Can we have a quick brief introduction, and why have you taken up this course? Any reason?
Yeah, good morning. My name is Omong.
Good morning.
Yeah, so I'm actually working with the NHS as a support
Okay,
worker.
great.
So I'll have the
Brilliant.
intention of going for the nursing courses very soon. So that's why. And I need the access certificate for this. So that's why I joined.
Brilliant.
I'm actually joining for the first time. I don't know if I've missed a lot or not.
Okay, we'll go through that also if you've missed. It's not an issue. If you've missed, you will always be able to catch up. That's not a problem.
Then I want to ask if there is any assignment that has been given out or not yet.
Yeah, so what happens in this, I'll just stop recording the session if that's okay. We'll just have a brief understanding of, I'll just pause it actually. Recording. Can you all see my screen, my slide, the first slide?
Yes, please.
Brilliant. Okay, so this is what we are going to discuss. So this is the first learning outcome. So it is about the understanding, your understanding of the concept of healthcare in the 18th and the 19th century. Now, remember, there have been a lot of changes in what healthcare was and what it is now. So there's some industries like changed tremendously, and healthcare is one such industry. So what those changes, how have those changes happened? So this is what we'll go through in the brief history. And it's a graded unit. So there's some indicative content for those who are new. This tells you about what we will be covering in our session. So the following grade descriptors will be applied to the assessment of this unit. So we will want to see that you have an understanding of the subject. We will want to also see that you can apply the knowledge that you have gained from here. This will again be assessed through the assessment. We will also want to see that you use the information appropriately. Your communication and presentation is appropriate. So you'll be given a task, for instance. We'll discuss this in the assignment discussion, and then we'll be expecting you to communicate this task appropriately. And then we'll be also seeing the quality of your work. Um, Please refer to the QAA grade descriptors for detail of components of each descriptor. So you'll have this on your Moodle web page. Some key terminologies have to be discussed so that you have a clear understanding of what going to talk about. So the first point is, what is medicine? Okay, we're talking about medicine and health. We're talking about a history, brief history. So medicine, it is the science and practice, uh, as any practice, but this refers to the caring of a patient. Okay, so medicine has to have a patient, managing the diagnosis, prognosis, prevention, treatment, palliation of their injury or disease. That means reduction or ease in their injury or disease, and promoting their health. So this is so if there's a patient, how do you prevent ill health, or how do you prevent disease in that patient who already is diseased? Any idea? How do you prevent disease in someone who has already got it? Any idea? Okay, so let's say there's a patient who has diabetes mellitus, a chronic disease. A chronic disease is one that goes on for very long time. Um, so more than approximately 6 weeks or 2 months time. So what happens here, sorry, that this patient might develop more diseases. So with diabetes, you're prone to develop other diseases also, such as cardiovascular disease. You can develop kidney disease. You can develop eye diseases. So what medicine does, it is preventing these diseases from happening. Okay, so prevention is always, we've heard that, but that is true, that it's always better than curing. So when you're treating, you need a lot of resources, you need a lot of money amount to cure someone. Okay, because diseases are expensive. The drugs are expensive, especially when the NHS is working on just taxes and just funding from they've got no international funding. It's only within the this territory that you have that generates its own amount. And on top of it, when you have um, things like COVID-19 going on. So we have heard about this new virus. I'm not sure if you've heard about it. I always talk about what's happening in the latest advancements in health, or the recent threats to health. So there's a new variant of COVID-19 that has been in the news. It's been its strains have been found in China. Unfortunately, the first case last week, Tuesday, it was reported in Bangalore, India. So it's hard to stop diseases from going across the borders. So this is what we do. We prevent disease from happening. Okay, so that there's not much expenses which we cannot bear. The health system cannot bear. What is health? So health, we have a definition for health, which is the World Health Organization definition. So it is the state of complete physical, mental, and social well-being. This was the end of the definition. So it was always said that health is a state of complete physical, mental, and social well-being. But now it has been added that it's not merely the absence of disease and infirmity. So only absence of disease is not health. It has to be complete physical, mental, and social well-being. Okay. So a resource for everyday life, it's not the objective of living. So health is a positive concept that emphasizes social and personal resources as well as physical capacities, according to WHO. So this is a short video that you can have a look at in your free time when you're free. I'll share all these links with you just in a while. This link, I'll share it with you in the chat box so you can have a look at it. So what is medicine? This video tells you about. It about this video, it is medicine is the science and practice, and it involves the practice of caring for a patient, managing the patient's diagnosis, prognosis, prevention, treatment, palliation of their injury or disease, and promoting their health. There's this again a brief history of medicine. This video that you can watch when we're done with our lecture. Unfortunately, we don't have enough time to cover these during our lecture, so you can have a detailed look. So we're talking about it already. So this is just an added thing. So we had talked about two concepts. So the patient knows best and the doctor knows best approach to medical treatment. So we'll talk about the doctor knows best in our next session. um, Today we are talking about the patient knows best approach. So what is this approach? Um, so the patient knows best, or PKB, it's an innovative solution. So this gives authority to the patient. So it's an innovative solution to put people in control of their medical and care information. And this creates a basis for truly personalized care. Personalized care means that it is patient centered or person centered. Okay. There's an article on Moodle that you can read about the patient knows best. Okay. So there's these videos and this article. This will help you tremendously when you're doing your assignments. Okay. So just after you're done with this session, when you're making notes, just make a bit notes on this so that helps you in your assignment when you're doing it. Uh, so what does patient-centered or person-centered approach uh, embody? What does it entail? It it comprises of empathy. It comprises of empowerment. It is a holistic approach, means it has prevention, it has disease reduction, it has rehabilitation, it has primary, secondary. It's a holistic approach. Okay, so And by holistic approach we also mean to say that it has everything that deals with a person. Okay, so every need of the person, if it's preventive, if it's curative, if it's just putting the patient at ease, if it's mental health, it is a holistic approach. And it makes the patient or the person empowered, that they have the power to decide for themselves to some extent. Obviously, if the patient does not need antibiotics, the patient cannot be empowered to have those antibiotics if they don't require them. However, if the patient needs a certain appointment, for instance, at a certain time, then you would be willing to go out and beyond when it's a person-centered approach to facilitate them for that. Okay. And then it's empathy, feeling for the patient or the person. Collaboration, so this is collaboration means the person is not being treated as just one person. The person has a lot of people around them, so it's their family members, it's their friends who can be collaborating. And with collaboration we also mean that it's not just one treating doctor, it's the nurse, it's the paramedic staff, it's the pharmacist. All of them collaborate together to create this person-centered approach. It's giving this person independence. The patient has independence and a certain degree of independence, and culture and background of that individual is also considered. Okay, so no matter what the patient comes from where the patient comes, um, their culture and their background does not impact the care that is given to them. And then it gives them good decision making power also to the patient to some extent, obviously, which is not harmful for them. The patient, again, we're talking about what the patient knows best. So there's certain concepts related to this patient-centered approach. So it is a theoretical framework, and it emphasizes involving patients in the healthcare decisions and considering their preferences and their values. Do they prefer coming to one healthcare center that is a bit far for them, or are they comfortable going to a healthcare center that is very close to them, or do they prefer a public health nurse coming to them? Okay, so this is what independence, giving value to them, means. So when it is patient centered, the patient knows best aligns with the principles of patient centered care, and the healthcare professionals, they prioritize the patient's preferences. So they have their own understanding, so the doctor knows what is best for the patient, but they have still they have the patient's preferences in front of them, and they do their best what they can to um, go with those preferences. This also includes the values and needs in medical decisions. This approach also emphasizes shared decision making between the patients and the healthcare providers, aiming to improve patient satisfaction and the outcomes. Again, Patient Knows Best platform. This is also a platform called Patient Knows Best, and it provides patients with access to their personal health information online, and it allows them to store and manage their health records securely. Okay, so you have certain health records. They can be stored, they can be managed in a secure basis. This platform aligns with the concept of patient empowerment by giving individuals control over their health data. Okay, so this is a whole a platform or a whole website that has the patient information, and they have access to their information and to their treatment records and other records as well. Um, so this is what the patient knows best is about. So we've talked about this, and then we are going to talk about um, going on to explain in detail how dissection um, led to the practices now used in modern medicine. There's an article on Moodle. Please go and read that. It's Human Cadaveric Dissection. It's a historical account from ancient Greece to the modern era. Please have a look at it on Moodle. I have it, but it's for your it's a task that you need to go and do for this assignment. And then we would want to evaluate the importance of the rise in laboratory medicine in hospitals. There's again an article on the future of laboratory medicine, understanding new pressures. Please go and read the article. Laboratory medicine is faced with evolution of medical practices. And then there are 10 advances in laboratory medicine. uh, all these articles are on Moodle. So why are laboratories important? They're there because we need to investigate disease. We need to prevent harm from happening. We need to prevent um, uh, infirmity from happening or disease from happening. And this is what we do in labs. Then coming towards what is meant by the germ theory. Okay, so the germ theory, it was introduced early, and it is when the germs had started coming in and showing their impact and were identified as causing harm. So we have the scientific theory where it is the germ theory is described as it's one of the several scientific theories that you will read about in human biology. A scientific theory, what is it? It's a broad explanation of what happened and when did that they happen. These events are very important to know if you need to know the history, obviously. Scientific histories, they're widely accepted by the scientific community. So everyone agrees to them. They have been peer reviewed. Everyone has reviewed these and they've authenticated them that yes, these are true histories. To become a theory, an explanation must be strongly supported by a great deal of evidence. So that evidence re- uh, has already been out there, and that is when these theories have been accepted and have been come into practice as well. So, because obviously, with theory, you improve your practice. Okay, so when there's a theory out, then you improve your practices. Germ theory is similar to that. People commonly use the word theory to describe a guess or a hunch about how or why something happens. For instance, you may say, I think a woodchuck dug this hole in the ground, but it's just a theory. So, word, when you're using it in this way, it's different from what it is used in science. A scientific theory is not just a guess or an idea or a hunch that may be true or false. In science, it is an explanation, theory as an explanation that has a likelihood, a high likelihood, high possibility of being correct because it is so well supported by evidence. So, evidence, whenever you have evidence, that is when a theory is generated. And there are high chances that it is true instead of being false. Again, this is a video that I will just share with you. This is on clarifying what is meant by germ theory. So there's a link between germs and disease. So microorganisms were discovered in the 17th century. Uh, so even then, there was no clear connection between the germ and the disease. So scientists, they believed that microbes would be responsible or these microorganisms or these tiny germs, they might be responsible for causing disease. This theory was known as spontaneous generation. Um, you will look at the video and then you will understand a bit more about what germ theory is. So this theory states that contagious disease, so there's a contagious disease where it can be transferred from one person to another. These diseases are caused by germs or microorganisms, and these microorganisms, they're so small that you cannot see them without magnification. And that is through a microscope, and that is in a laboratory that you have there to see microorganisms. They cause disease. The microorganisms, there are millions of microorganisms out there, but the only ones that cause disease are known as pathogens. Where does this word pathogens come from? It comes from pathogenesis or pathology. So we know that we have a human anatomy, we have human physiology, the way the anatomy is the structures, how they are made. Physiology is how work or how they work, these structures works. For instance, the heart beats, that is the heart physiology. Pathology is a disease. So if the heart beats very fast, it's a pathology. And when these organisms, these microorganisms, they're there, they cause disease, they are known as pathogens, means they cause disease, they cause pathogenesis, or they cause a pathology. Okay. Human pathogens, they include bacteria, viruses. You can't see them through the naked eye. There are many more. Okay, but these are the ones that cause the most harm. When pathogens invade humans or other invade in living hosts, they grow, they reproduce, and make their hosts sick. Sorry. Okay. So illness, we know that is caused by these microorganisms. Diseases that are caused by germs, they are contagious. Now, what is contagious? Again, they can be transmitted from one person to another. Some contagious diseases can be transmitted from um, non-humans, such as animals, to humans. Okay, so for instance, bird flu could be transmitted from animals to humans, but they're very less. Okay. So that is what contagious diseases are. Infectious diseases are there also. So an infection can cause an infectious disease, but they're not necessarily going to be contagious. So contagious will always be spreading from one person to another. The first statement about germ theory was it came from an Italian physician named Fracastoro. Here in the mid 1500s. Fracastoro proposed uh, this theory that contagious diseases are caused by transferable seed-like entities, which are now called germs. They did not know what these germs are, so they just call them seed-like entities. So once that seed is inside the human being, that is when the reactions happen, the pathology happens. According to Fracastoro, germs spread through populations through direct or indirect contact between individuals, making them sick or making them ill. So direct contact is obviously when one person is sitting and the other person is sitting close to you. Um, and they're talking and they sneeze and those germs directly go. So let's say there's a flu virus, that flu virus goes directly to the other human being and infects them. Indirectly is when those germs are there on the beddings, they're in the soil, they're in the environment, and there's another person who comes and inhales that. So that's an indirect spread as well. Okay. I hope that's clear. Just a minute. Just looking at the time. So that's it. Yeah, we have just two or three more slides left. Perfect. Any questions, please feel free to ask me, and please let me know if I'm going too fast or too slow. Please, uh, this is just for you, the session, so I want you to make the most of it. If you have to ask questions, if you want more explanation, please let me know. So one of the first physician, there's puerperal fever. There came evidence from this particular fever. A bit about it. So, one of the first physicians who demonstrated that a microorganism is the cause of a specific human disease, it was a Hungarian obstetrician, a person who dealt with deliveries, surgeries for women who were pregnant. Semmelweis in the 1840s. The disease was puerperal fever. It's often a fatal infection of the female reproductive organs. Okay. So puerperal fever is also known as childbed fever because it usually affects the women who have just given birth. Okay. So what this scientist or this obstetrician observed was that deaths from puerperal fever, they occurred much more often when women had been attended by doctors at that hospital than by midwives at home. So the hospitals, they're there to prevent deaths, isn't it? But these women died more and they had more fever in the hospital instead of having those that fever at home when they were attended by midwives. So Semmelweis also noticed another point, that doctors often came directly from autopsies of beds of women about to give birth. Okay, so they've given they've been to the beds where women have given birth, or they've just come out from surgeries or autopsies. These doctors then directly come to these women, and these women get infected. Now he observed at, and he said that a puerperal fever was a contagious disease and was caused by some type of matter that was carried to pregnant patients on the hands of the doctors from autopsied bodies. So there were bodies that were cut open, and then these bodies, and they were treated, however they were treated, and those doctors came directly to the mothers who were pregnant. As a consequence, they developed this puerperal fever and died because of it. Sommelweis then urged doctors and medical students at his hospital to wash their hands with chlorinated lime water before they examined pregnant women. After this change, the hospital death rate for women who had just given birth fell from 18 to 2%, which was a 90% reduction, which is a big wow. Yes. So this is what just hand washing caused. Imagine what other PPEs would do. Yeah. So this is what happened. This is evidence from puerperal fever. Then coming towards Louis Pasteur, who was the father of the germ theory, who brought out this puerperal this cause of disease as puerperal fever. So throughout the later 1800s, there was more investigation between the relationship on the relationship between germs and disease. So some of the most important were undertaken by Louis Pasteur. So Pasteur was a French chemist who did careful experiments to show that fermentation, it is a process which food is spoiled, food spoilage, and certain diseases, they're caused by these microorganisms. So these are not visible like this. They're only seen through the microscope. He discovered the cause of puerperal fever in 1879. He determined that it was an infection caused by bacterium Streptococcus pyogenes, which is showed under the microscope, under the magnification below. So this was proposed. This is a germ. They called this a germ. This bacterium was called a germ. So this was the basis of germ theory. Um, so although Pasteur was not the first person to propose the germ theory, his investigations did support it. He also became a strong proponent of the germ theory, and he managed to convince most of the scientific community. So as I said, a theory is most likely to be positive. Pasteur is often regarded as the father of germ theory. Okay, so a summary of what we've talked about. We've talked about a scientific theory. It's a broad explanation of what is already accepted because it is strongly supported by a great deal of evidence. An example of a scientific theory is the germ theory. The father of this germ theory was Louis Pasteur. According to this theory, contagious diseases are always they're caused by germs or microorganisms. And the germ theory of disease was first proposed in the mid 1500s, was not widely accepted until the late 1800s because they needed more evidence. It was strongly supported by experimental evidence from Louis Pasteur. So these are some of your references that you should go through. They're all there on your Moodle webpage. Um, Again, refer to the resources that have been given to you. These readings are very essential. Any queries you have, excuse me, it's learnerwork@ukversity.co.uk. Again, submission of the assignment will be done at the same link. learner your assignment submission will happen after 2 weeks of the completion of the units and its delivery, so not it's not until next weekend. So that's about it. I'll start sharing the links with you. I'll stop sharing this. If you have any questions, I'll stop recording this session. um, Please let me know if you have any questions. Let's see. It's, I'll just start sharing these links with you for um, I I I would appreciate if you don't leave at the moment. Just have a look at these links, which I'll just share with you. So these are all the links that are there for you to go back and look at. Um, they're all about whatever we've talked about already. Um, I'm just trying and stopping this recording.